Hi, my name is Naida Cole. I'm an obstetric anesthesiologist and assistant professor at the University of Chicago. The purpose of my work on the FAER Mentored Research Training Grant is to investigate why oxytocin sometimes fails to prevent and treat uterine atony and hemorrhage after childbirth. As many of us know, the US has the highest maternal mortality among developed countries, and we've seen a 59% increase in this rate just during this millennium. One of the top three causes of this maternal mortality is postpartum hemorrhage, with 80% of it caused by uterine atony. Oxytocin is our first-line drug to prevent and treat atony, but it fails to do this at least 7% of the time, so that up to 250,000 women every year suffer from its associated morbidity in this country. We've been using oxytocin for decades, but we still lack an understanding of the reasons for its unpredictable failure. Its pharmacokinetics are poorly understood, rational dosing is non-existent, and dosing regimens vary greatly. So my goal is to examine the hypothesis that oxytocin failure is related either to its pharmacokinetics, its pharmacodynamics, or both. To evaluate the pharmacokinetic properties of oxytocin, we have to distinguish exogenous dosing from the existing endogenous hormone and variable intrapartum oxytocin therapy. We are therefore planning to administer deuterium-labeled oxytocin during cesarean delivery so that the deuterium acts as a tracer to be detected with mass spectrometry. For the pharmacodynamics of oxytocin, we will examine the concentration-response relationship between total plasma oxytocin concentrations and intraoperative clinical assessment of uterine tone. This research will generate insights into the mechanisms of refractory uterine atony, addressing the #1 worldwide cause of maternal mortality, postpartum hemorrhage due to atony. I'm indebted to Drs. Brian Bateman, Evan Karish, Peter Nageli, and Stephen Schaefer for their commitment to this work and the invaluable wisdom they've already shared with me. I'm also grateful to FAER for providing me with the resources to examine this public health issue and the time to benefit from necessary training for future research. I look forward to sharing our findings with you very soon.